The Primo AirFloat lateral transfer system simplifies patient handling by making boosting, turning, repositioning, and transferring smoother and more efficient. Floating on a cushion of air, the AirFloat sheet minimizes the force required for surface transfers, reducing the risk of injuries for both patients and caregivers. This air cushion significantly cuts down on friction and shear, allowing for stable and comfortable patient movement. The AirFloat offers unparalleled comfort and security during transfers with its cradle design. Featuring a specialized micro-suede material, the AirFloat enhances patient comfort and maintains an optimal microclimate for extended use. It is also clinically designed to minimize the risk of pressure injuries and works effectively with Primo body wedges and underpads for positioning and moisture management. The electric blower comes with a 2-speed variable power switch, offering multiple levels of inflation to suit different clinical needs. Before each use, inspect the transfer sheet for any damage or missing parts. Position the AirFloat lateral transfer sheet on the bed before the patient arrives, or use the log roll technique to place it under the patient. Lock both bed brakes and raise the exterior bed rails. Ensure the patient is supine and both surfaces are completely horizontal. Center the patient using head and foot markers. Position the receiving surface next to the sending surface, lowering the interior bed rails, ensuring the bed is in a fully flat, supine position. Note, the receiving surface should be slightly lower than the sending surface to facilitate a smooth transfer. To attach the blower hose, first find the buttonless end and connect it to the blower. Then insert the hose nozzle into one of the 2 air inputs located on either side of the foot of the sheet and snap it into place. Because the Primo AirFloat is designed with airport connections on both sides, we recommend attaching the hose to the side of the sheet the patient will be moving towards during the transfer. Close the air input tightly with a hook and loop fastener. Ensure nothing is obstructing the sheet, blower cord, or hose. Switch the air blower to the high position and let the sheet fully inflate. The blower is designed with a 2-speed inflation system. If a patient requires the low setting for initial inflation, be sure to switch the blower to high mode before performing the transfer. The caregiver on the sending side pushes on the sheet between the patient's shoulders and waist. The caregiver on the receiving side pulls on the extended handles once within reach. Confirm the patient is centered on the receiving surface once the transfer is complete. Switch the air blower to the center off position and disconnect the hose from the air input, smoothing out the sheet as it deflates. Separate the surfaces and raise the bed rails if applicable. The Primo AirFloat sheet is versatile and can also be used for positioning, turning, boosting. Always adhere to your facility's protocols while performing these movements. During patient skincare checks, you may find that the underpad needs replacement. If the underpad is soiled, remove it and replace it with a new one. The AirFloat is a single patient-use product but can be spot cleaned with an antiseptic wipe for light soiling. For detailed cleaning guidelines, contact your ASP Global representative. Thank you for choosing the Primo AirFloat lateral transfer system. For more information or assistance, please reach out to us.